Hi, I'd like to talk to you today about the mental health system and particularly why someone with Kundalini symptoms shouldn't go and get involved with the mental health people, with their particular practice and indeed with the system itself. Now, before I begin, I would like to start with a disclaimer. I'm clearly not a doctor and I'm not here to give medical advice. Nothing I say here is intended to be taken as an instruction, and neither do I or the ESF have any responsibility for anyone's actions as a result of this video. If you are concerned that your symptoms are medical in nature, please seek medical advice from a general practitioner. Resisting seeking this advice could lead to serious complications and consequences for yourself. If you are, however, satisfied that you are experiencing a Kundalini Awakening, if there are no underlying health problems, then I wish to inform you about how the mental health system deals with people in this situation. Now, this video isn't about me. This is predominantly about a friend of mine who I went to school with many years ago. His name is Carl, and we've kept in touch since then. Carl had a Kundalini Awakening in 2013. He didn't know what it was, his family didn't know what it was, and the doctors did not know what it was. Carl doesn't want to be identified and doesn't want to appear in this video, so I'm presenting for him. He's told me all about his story, and he's given me some documentary evidence from his 3 years in the mental health system. Now, when this first happened to Carl, he, like I said, did not know what on earth was going on. He had no previous understanding of Kundalini. He was not practicing yoga. This scared him and his wife, and she insisted that he went to the GP in the first instance. Now, I must say that what I'm speaking of here is the British NHS system, but I would imagine equally applies around the globe, depending on whichever country you're in. I'm sure all of the doctors, all of the mental health professionals have had very similar training. It's likely to have come previously from such philosophies as Carl Jung and Sigmund Freud, and unfortunately they're stuck in that way of thinking. Now, Carl didn't want to go to the doctor. Carl wanted to deal with this himself. He didn't feel this was a medical problem, and he really didn't want to get tangled up in any medical prescribing of drugs or any assessments and ongoing meetings about his mental health. But his wife made him promise to go and see the GP initially. So Carl went to the GP and initially explained what had happened. He described the symptoms of Kundalini. He described anxiety. He described energy sensations rising up his spine. He described feelings of love and bliss. But unfortunately, this fell on deaf ears, and the GP thought he was mad. The GP instantly referred him to the local mental health team and effectively washed his hands of the situation. Now, Carl's wife was very upset by this. Carl's wife wanted the thing resolved there and then. She was not happy and cried in front of the doctor. And unfortunately, this only enhanced the need that the GP saw for Carl to see somebody in the medical or the mental profession, as his symptoms were clearly upsetting his family. When he went to the mental health team, he told them of his symptoms. He told them that he thought it was a Kundalini Awakening. He did not tell them that he was suffering any sort of psychosis, schizophrenia, anything that he believed would have been, attributed to madness. But unfortunately, the mental health team saw otherwise. They were very quick to arrive at a diagnosis, and they called it an acute psychotic episode. They did no physical checks, there was no blood work, it was simply from discussion, and unfortunately, as Carl's wife was in attendance, it was again her testimony and the fear that the medical team saw in her eyes that essentially led the mental health team to prescribe drugs. Carl thought, quite rightly, that he was about to be trapped. He was about to get caught up in a mental health red tape bureaucracy that may take years to get out of, and it ultimately did take years to get out of. He was effectively trapped by the mental health system for a condition that was not madness, it was not psychosis, it was not schizophrenia, but that's the only thing that these people had been trained to understand. So the mental health team immediately subscribed antipsychotic medication and antidepressant medication. Carl told them he was neither psychotic nor depressed, but nothing he could say was able to convince them otherwise. Carl tried to explain that he thought this was a yoga situation, that he had been reading about Raja Yoga and about Kundalini Awakenings, and he felt he had undergone a Kundalini Awakening. However, the official advice from the NHS was that the practice of yoga was dangerous. I'll say that again. The NHS thought that the practice of Raja Yoga, a centuries-old tradition in India, was dangerous to a British person. They told him he should not attempt to do anything, meditation or otherwise, about it. So, at the end of his first visit to the mental health team, the medical professionals, the mental health team, they had a closed-door discussion about him. They went away and discussed what to do about his situation. Now, when they returned, they were all in unanimous agreement that he had an acute psychotic episode. Now, this was not described to him. This was not given any further meat on the bone. They did not explain exactly what they meant by this, only that they had now labeled him as such, and he was now in the system. The appointments came regularly. Carl attended every one, and in every meeting there was a set pattern. Carl got suspicious about his treatment. He felt that the medical professionals did not know what they were doing, and they were constantly probing his own memory and his current state to try and prove that he was either psychotic or schizophrenic. Carl felt they were doing things wrong, that they should be taking another path. He had, of course, been doing further reading. He'd discovered Gopi Krishna. He had been reading more about Kundalini Awakening and was more convinced now than ever that that is what had happened to him. It had been a negative experience at first. He had gone through some anxiety. He'd gone through some fear. But that's as far as it went. He then transitioned through that, and it became a feeling of love, a feeling of bliss, and a feeling that everything was okay again. Now, what he did was he started recording the meetings he was going to. He was recording the sessions he was spending with the mental health team, and I have one of those here. So I've actually split this into two parts. The first one, I want to simply play you some of the questions that Carl was asked every time he went to see them. This will give you an idea of the sorts of questions you would be asked if you were in this same position. So let me play that for you first, and then afterwards I have a recording of the summing up from the mental health professional of what he thought Carl's problem was and how he perceived this would be resolved.
Do you think they were trying to harm you and things like that? Did you think people were talking about you like that? Okay. But were there some words you thought they were talking in relation to you, sort of? Okay. You didn't hear voices when there is no one around you like that? Okay.
So he's constantly pushing for the schizophrenic approach, trying to get Carl to say he's hearing voices, that he's perceiving people are out to get him. And this wasn't the case, but in every meeting this came up.
Okay. And you didn't have any thoughts to harm yourself or anything like that? Yeah. Okay.
One of the other avenues was always self-harm. They were constantly checking to make sure Carl was not trying to injure himself or anyone else.
And you don't take drugs and alcohol? Okay.
The question of drugs and alcohol. Maybe they were reaching around for some explanation as to why this otherwise sane individual was having these experiences. So every session it was a question of, are you taking drugs? Are you abusing alcohol? The answer was always no.
I never had problem with the police before or anything like that. That's fine. Okay.
And then the question of getting in criminal trouble. Have you had any dealings with the police since the last time we spoke? I don't know why they asked this. It seems very strange to me, but ask it they did.
How does it feel about you now? Yeah.
So the question of family and how does your wife feel about you? It wasn't a question of how is she coping, but how does she feel about you? Now that's a very interesting and odd approach.
Getting good support from the family.
And the last question there is, are you getting support from the family? Now, Carl's family were very supportive. They were very helpful with his children. They spent a lot of time looking after them, and he was very grateful to them for doing so. He and his wife were often having to go places to attend different appointments, and the family were actually a great help. So that's the first recording. The second one is the summing up by this doctor of what he thought the problem was. And bearing in mind, this is just one recording from one session, but to be honest, from the paperwork I've seen, it's the same every time.
Yeah, that's very good. I think it's like a very short episode, stress-induced acute and transient psychotic episode, we'll say that, which means it starts and within 2 days it starts resolving. For you, it all started around Christmas time. Before the Christmas 23rd it started. Then it built up. We saw you on 30th, yeah? It went on for that week and things got worse. Was that it? Is it? Okay. So it's clearly, it seems to last for 2-3 days really. Yeah? Okay. I would say it's an acute and transient psychotic episode due to all the built-up stress, and it has resolved. What I feel we could do, we'll just continue with the 5 milligram for another month. If things are going well, we'll reduce it to half a tablet for a couple of weeks, 2 weeks, and then stop it off and see how things go. I think I won't worry really. But one thing is that stress can bring it on you again. This shows what happens. Yeah, you're not of the serious mental illness, correct? No, I won't worry. We can discharge you back to doctor's care. We'll discharge you. I'll suggest the plan. Yeah, things are going well. But I would say, do you think, I'm wondering whether for a month or a little bit more, it's only a short episode, I'm just thinking, the olanzapine, you're not having much problem with it, you're able to manage eating more healthy.
So there was some interesting psychology going on there. So clearly the doctor laid out what he thought this was, a acute transient psychotic episode. He put Carl at ease. And as he was saying everything's fine, everything's good, he came back at the end with a change of view. He thought suddenly, after saying there's no real problem here, I want to put you on higher medication, that you need more drugs. Now I don't understand what this thought process was. Maybe it was, a psychological trick to lull Carl into thinking, hey, everything's great. I'm going to get discharged. I'll go back to just see my GP. No problem at all. But bang, I want to up your dose. I want to give you a higher milligram dosage of antipsychotic medication. Why? So I'd like to spend a little moment talking about the drugs themselves. Carl's told me how they affected him and how they affected his family around him. He was taking 2 types of drug, and this was on reoccurrent sort of occasions. The first was an antidepressant, mirtazapine, and he was taking 30 milligrams of that. The second was an antipsychotic drug, olanzapine, and this he was varying the dose as per the instructions of the medical professionals, but on average it was 10 to 15 milligrams of this. Now, Carl tells me that the drugs allowed him initially to get good sleep, and this was beneficial, but there was a big downside. So his thinking became blurred throughout the day. He had to keep a job. He obviously returned to work after the doctors said, you're on drugs, get on with it. And he found that it was difficult to concentrate. He had a complex and difficult job, and with the blurred thinking, it made it especially difficult. On top of this, the drugs made him drowsy throughout the day. It made it very difficult to get up in the morning. And Carl tells me that he was taking 2 coffees just to get out of bed, really. Staying focused on his tasks at work was difficult, and it took superhuman effort just to concentrate and to focus on what he was supposed to be doing without his brain wandering off in a different direction. Carl says to me that it felt a bit like he was in a drunken haze. Finally, for his family, they found Carl to be distant and to be distracted, not like his old self at all. He would often go to bed at 8 o'clock and sleep through to 7 the next morning. The drugs changed his character and changed the person that they were used to. Carl felt lonely. He felt abandoned. The drugs didn't work. They were for something else. He was still suffering while this was going on. The Kundalini symptoms were washing over his body despite the drugs, and he tried his best to simply hide it, both from his family and from the medical professionals when he had an appointment. He read everything he could on the subject. He wanted to know what Kundalini was and how he could possibly stop it happening. Over time, he learnt to cope with the symptoms. He returned to work, as I say, but he found it difficult. However, it was necessary. He had to provide an income for his family. His wife wasn't working, his children were very young, there was childcare costs. He couldn't rely on grandparents the whole time, and so he had to go to work, and he had to bring in the money, which was more difficult now than it ever had been to do. Carl had 2 relapses. So first of all, 6 months after the initial problem, and then 12 months later again. It was history repeating itself. Each time it was the same problem. And the drugs, as I said, were not working. He felt that he was stuck in a system that was poorly diagnosing him and pushing drugs upon him. So I'd like to go through some of the letters now. I've highlighted on them some particular things that I want to talk to you about. So the first letter then clearly states that the medical professionals identified Carl's problem as a stress-induced transient psychotic episode which had now been resolved. Now, bearing in mind he had 3 reoccurrences, but from initially they thought this was done and dusted, that the drugs were working, that was the end of it. It's interesting that throughout all of the documentation I have, not once is it written down that Carl had been telling them these were Kundalini symptoms, that he had researched it, that he understood it, and this is what he felt was happening to him. In every case, the doctors altered his statements, basically making them disappear from the notes, and instead they simply put down that he was having psychotic symptoms. Carl denied having psychotic symptoms. He denied that he was depressed. But still, the doctors put that down and continued to write that he was having delusional beliefs. The doctors also, I feel, were rather arrogant. So they keep saying that the problem was resolved. They didn't understand what was wrong. They hadn't waited long enough for it to pass. They hadn't waited for Carl to deal with it himself. They'd simply subscribed drugs and said, job done, off you go. But it's interesting, despite them saying that he didn't appear psychotic, they do highlight that he could develop psychosis again in the future. And this is a recurrent thing. I don't know if it was them covering their backs so they couldn't be sued later on, but that's certainly what they did. So they write here that on the day there was no evidence of thought disorder or delusional beliefs. There's no evidence of psychosis. And yet they still write this up as an acute psychotic episode. So that was the first visit. Then 6 months later, Carl returned with similar symptoms. And again, you can see that they initially diagnosed this as acute psychotic episode. They say of Carl that he has no insight into his own problem, despite him telling them that this is a Kundalini problem. And again, they report that he has no evidence of psychotic symptoms. One aside that they took was that because this is now a reoccurring problem, they wonder if it never went away in the first place and write one long episode with 2 peaks. Clearly, they said it was resolved 6 months ago, and it hasn't been. And the summing up says, in my view, we are still looking at an acute psychotic episode. They rule out at this stage schizophrenia, which is good. But again, I don't know on what grounds they do this. And the other thing to point out here is that they decide at this point that antidepressants are not the way to go. That antidepressants are not providing any improvement to Carl's condition. So now we move to a year later. Carl's been managing his condition very well on his own. At the present time, he's off drugs, and he wishes to remain off drugs. But Kundalini returns, and he goes back to the doctor and then to the mental health team. And again, we have a very, very similar assessment. The results, acute psychotic episode. Now, I'm no doctor, as I said at the outset, but if you're having 3 acute psychotic episodes, is that not, in any logical person's mind, a cause to rethink what's going on? The fact that it's acute means it's going to happen once, individually, on its own. You can't really have 3 acute reoccurrences. It's no longer acute at that stage. What we have here is a pattern, and that pattern is revealing something else that the doctors are not able to see. The doctors have no training in Eastern philosophy, Eastern religion, or anything historical back past Freud. As a result, they don't know what to do, and I think that's evident from the documentation here. If you end up in this same situation, I think you will also be misunderstood by science, by the medical profession, and by the training mental health professionals have received. Carl went through this for 3 years and thankfully is managing very well with his symptoms now. I really don't want anyone else to have to go through this. So that's all I wanted to say really about Carl and his condition and about what he went through. I'd like to finish just with a summary, the key points, if you like, of the last 20 minutes or so. So to sum up, the NHS treats these symptoms in the wrong way. And the reason they do that is because they don't understand A, what yoga is, B, what Kundalini is. They don't do a physical assessment, which I think is very wrong. I would have expected on first presentation them to not only do blood work, but a full physical exam. And they didn't do anything like that. It was simply talking and prescribing, and off you go down the rabbit hole. They also don't seem to recognize that their treatment isn't working. They stick to their guns, as we saw. They called this an acute psychotic episode, even though it repeated 3 times. There was a suggestion that maybe it was one long acute episode that had peaks and troughs, but I think that was just them covering their rears. The biggest thing that I want to share is, as I've said, the responsibility for getting well lies with the individual. The modern mental health, education, and pharmaceutical system can't help you here. If you are indeed suffering Kundalini and you have no other underlying health episodes, you're effectively on your own. I would suggest you stay well away from professional help here. Instead, hit the sacred texts. Go read about the Vedas, the Upanishads. Pick up the Bhagavad Gita. Go and learn about yoga. Go and learn about the Eastern traditions of old. The answers you need are in there. And the practice of yoga and meditation are your key out of a horrible situation that has some upsides. Thank you.